Bismillahirrahmanirrahim. Hello friends. Today we will discuss about the periodontitis. Introductions. A chronic bacterial infection that affects the gums and bones supporting the teeth. Periodontal disease range from simple gum inflammation to serious disease that result in major damage to the soft tissue and bone that support the teeth. There is a diagrammatic representation of the coronal section, sagittal section of the tooth, showing between the healthy and periodontal disease teeth. In one side, we have healthy gums in which the healthy gingiva is attached to the tooth and the bone is not resolved. In the periodontal disease, there is a gum recessions, plaque formations, and pocket formations, and there is a bone resorptions. Types. We have gingivitis and periodontitis. Gingivitis is early stage of the disease in which red, swollen and bleeding gums occur, usually reversible through good oral hygiene and preventive cares, not uncommon in young adults and even youth. Periodontitis, advanced stage of disease, chronic inflammatory response leading to irreversible destruction of the tissue and bone that support the teeth. Treatment require more aggressive surgical cares. What causes the periodontal disease? Our mouth are full of bacteria. These bacteria along with mucus and other particles constantly form a sticky, colorless plaque on the teeth. Brushing and flossing get rid of the plaque. Plaque that is not removed can harden and form tartars that brushing does not clean. Only a professional cleaning by a dentist or dental hygienist can remove tartar. Risk factors. The factors which are causing the periodontal disease are listed below. Smoking is a risk factor. Hormonal changes in girls and women, diabetes mellitus, other illness like disease like cancer, AIDS, and their treatment can also negatively affect the health of the gums. Genetic susceptibility, medications. There are hundreds of prescriptions and over the counter medications that can reduce the flow of saliva, which has a protective effect on the mouth. Without enough saliva, the mouth is vulnerable to infections such as gum diseases, and some medicines can cause abnormal overgrowth of the gum tissue. This can make it difficult to keep teeth and gum clean. Symptoms of periodontal disease: bad breath that won't go away, red and swollen gums, tender and bleeding gums, painful chewing, loose teeth, sensitive teeth, receding gums, or longer appearing teeth. There is a classical symptoms or clinical features of the periodontal disease. There is a receding gums recessions occurs, and root exposed. Because of root exposure, there is high chances of root caries, and there is a plaque, calculus formations, swollen diagrammatic representations of swollen gum partially or obscuring teeth. Treatment of periodontal disease: deep cleaning like scaling and root planing by the dental specialist and dental hygienist. Medication, surgical treatment. Deep cleaning like scaling and root planing. The dentist, periodontist, or dental hygienist remove the plaque through the deep cleaning method called scaling and root planing. Scaling means scraping off the tartar from above and below the gum lines. Root planing get rid of the of rough spots on the tooth roots where the germs gathers and help remove bacteria that contribute to the disease. In some cases, a laser may be used to remove plaque and a tartar. This procedure can result in less bleeding, swellings, and discomfort compared to traditional deep cleaning methods. Medications: prescription antimicrobial mouth rinses like a prescription mouth rinsing containing an antimicrobial called chlorhexidines to control bacteria when treating gingivitis and after gum surgery. It is used like a regular mouthwash. Antiseptic chips, a tiny piece of gelatin filled with the medicine chlorhexidines to control bacteria and reduce the size of periodontal pockets. After root planing, it is placed in the pockets where the medicine is slowly released over the time. Antibiotic gels, gels that contain the antibiotic doxycycline to control bacteria and reduce the size of periodontal pockets. The periodontist puts it in the pockets after scaling and root planing. The antibiotic is released slowly over a period of about 7 days. Antibiotics microsphere. Tiny round particles that contain the antibiotic minocycline to control bacteria and reduce the size of periodontal pockets. The periodontist puts the microsphere into the pocket after scaling and root planing. The particle release minocycline slowly over time. Enzyme suppressants. A low dose of the medication doxycycline that keep destructive enzyme in check to hold back the body's enzyme response. If not controlled, certain enzyme can break down gum tissue. This medication is in a tablet form. It is used in combination with scaling and root planing. Oral antibiotics, antibiotic tablets or capsule for the short term treatment of an acute or locally persistent periodontal infection. These come as a tablet or capsules are taken by the mouth. And there is also a surgical treatment of the periodontitis. There is the flap surgery. A dentist or a periodontist may perform flap surgery to remove tartar deposit in deep pockets or to reduce the periodontal pockets and make it easier for the patient, dentist, hygienist to keep the area clean. These common surgery involve lifting back the gums and removing the tartar. The gums are then sutured back in the place so that the tissue fits around the tooth again. Surgical treatment, bone and tissue graft. In these, dentists regenerate any bones or gums tissue loss to periodontitis. There is bone loss radiograph. In a picture A, there is a slight interproximal bone loss, and there and B, greater bone loss is seen in advanced periodontal disease. Prevent periodontal disease. Practice good oral hygiene, dental hygiene. Consistent good dental hygiene can help prevent gingivitis, periodontitis. Brush twice daily with a fluoride toothpaste. Be sure to replace toothbrushes every 1 to 3 months. Clean between the teeth with a floss or interproximal cleaner. Eat a well-balanced diet and limit between meal snacks. Have a regular visits with the dentist for teeth cleaning or an oral examinations. If you smoke, you can quit. Smoking is a major cause of the gum diseases. Summary: periodontitis is a disease involving the pathology of one or more of the 4 components of periodontium. Periodontal disease is an umbrella term for several clinically similar types of diseases. Thank you very much. Please subscribe my channel for further videos. Thank you.